Hi, my name is Paloma, and this is my submission for my Module 4 assignment. So the scenario is the emergency medical team has brought a 54-year-old female patient to the emergency department where you are working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger, who called 911 from her cell phone after the woman screamed obscenities at her and then fell, seriously scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty and you can smell the stale body odor and urine. So based on the patient's first impressions of the patient's actions and appearance, what do you suspect she is suffering from? So based on the patient's physical appearance and actions, I believe she is likely to be suffering from some type of mental disorder or substance abuse. She seems to be very disoriented and unaware of her surroundings. She is also very agitated with those trying to help her, so her mental state is unstable. So the next question asks, what short and long-term health risks would you suspect this patient faces? So the woman is going to suffer from both short and long-term health risks. One of the short-term risks she'll likely encounter is starvation or malnutrition. Based on her appearance and smell, I would assume she was homeless. Homeless individuals do not receive adequate nutrition due to the lack of access to proper food. The woman is also at risk for acquiring urinary tract infections, not only because women are more likely to acquire these types of infections, but because of the lack of personal hygiene among the homeless population. There is little to no access to clean restrooms for these individuals. The long-term health risks she faces include depression and anxiety. According to the Psychiatric Times, poverty has many negative mental health effects, meaning the woman is especially vulnerable for developing mental illness, like anxiety or depression. Her substance abuse will also add to the detriment of her mental health. According to Moyni, substance abuse often leads to anxiety, panic disorder, and insomnia. The third question asks, why do you think the patient's hands were shaking, and what do you think causes her confusion and combativeness? So the reason the patient's shaking could be due to her malnutrition and lack of proper hydration. To flourish and properly function, the body needs ample nutrients and electrolytes. She's likely to be lacking energy and is extremely weak, causing her body to work twice as hard to properly function. The lack of nutrients like protein, calcium, vitamin D, all of which are important for a healthy working musculoskeletal system, could be the reason of why she's shaking. Her confusion and combativeness is likely due to the result of malnutrition and substance abuse. Extended use of substances like amphetamines result in restlessness and rage, according to Moyni. So the fourth question asks, what assessments do you think are needed for this patient? So to properly care for the patient, a few assessments should be done. These assessments should include physical examination, mental health examination, and several tests like toxic screens, complete blood counts, liver and renal function tests, and urine analysis. These assessments will clarify why exactly the patient is behaving the way she is and what the best route of care is. So the research portion asks, mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed and the support of insurance. Is it sufficient? What could make it better? Be specific and support your statements with a minimum of 2 outside sources besides the book. So mental illness management often includes both pharmacological treatment in addition to psychotherapies. Patients will likely receive prescriptions for medications that will aid the management of their mental illnesses. The patient will also be referred to try other mechanisms of treatment, such as increased physical activity, support groups, and changes in their diets and overall lifestyles. This could include quitting smoking or drinking or any detrimental activities that will fuel this mental illness. For therapy to be effective, according to the Journal of Behavioral Health Services and Research, the therapeutic relationship between the provider and the client is crucial. There is also several types of medications, making it easier to completely personalize a treatment plan for the individual and their mental illness. For example, antidepressants are not a one-size-fits-all type of medication. There are several types, including tricyclic selective serotonin reuptake inhibitors and monoamine oxidase inhibitors. The treatment of mental illness is oftentimes covered by insurance companies, as most are now required to. This means that mental health is viewed as a necessary care for patients. Medicaid and Medicare both put a strong emphasis on not just the treatment of mental illness, but the preventative care of it as well. According to Frank, coverage has improved for more than 170 million people in recent years when it comes to coverage. Although for some, this coverage is insufficient for their treatment, and there are still millions of Americans that remain uninsured. There is still lots to be done in the implementation of healthcare and coverage.